First, I wanted to just introduce a couple of my colleagues who are here. Tiffany Kirkwood is our coordinator of programs at the MHHDRC, and she's been my right-hand woman helping me with everything. And so we're really pleased and grateful for her. Dr. Peter Foss, who spoke last night, is my fellow researcher here at the Minority Health and Health Disparities Research Center. So we're pleased that he's here. And Tracy Thomas, who's the pre-health advisor and the coordinator of summer programs at the MHHDRC, is here as well. And she works very, very closely with the scholars, the Dillard scholars who are here tonight. And she is going to say a couple of things about what we call the DUPSI program. And then I will briefly introduce our panelists. So Tracy.
Thank you so much, Dr. Lesson. Good afternoon or good evening, everyone. Again, I'm Tracy Thomas. I serve as the pre-health advisor, and I work closely with our DIPSI scholars. So our DIPSI scholars, it stands for the Dillard University Pre-Health Scholars Institute. So these group of students, these students received scholarship funding to attend Dillard as incoming freshmen. And they indicated in their application that they were interested in pursuing a health profession that was related to a health disparity. And so part of the requirements once students are awarded the scholarship funding is during their matriculation at Dillard is to participate in scholarly and research activity related to healthcare disparities. And so under the auspices of the Minority Health and Health Disparities Research Institute with our faculty members, Dr. Lesson and Dr. Foss, we have our students tonight will talk about their perspective, COVID-19 pandemic and how it impacts them from a student perspective. Because we realize, the information that was put out earlier during the pandemic, it had more so to do with, the information said that it didn't really impact a certain age group, but now reality has shown otherwise. And so we wanted to invite the students to be a part of this conversation with Minority Health, Health Disparities Institute, the Research Center's Symposium this year. And so we're excited to have them share their perspective and engage in this conversation with their peers and the Dillard community.
Thanks, Tracy. So students, if you would like to unveil yourselves, we'd love to see you at this moment. So we have a number of our students here with us tonight, our DUPSI scholars, and they're going to introduce themselves, and I'll call on you by name based on where you are on my screen. So Bailey, would you like to go ahead and start?
Hi everyone, my name is Bailey Patterson. I am a sophomore public health major from Cleveland, Ohio, and I am interested in either physician assistance or physical therapy.
Thank you, Bailey. Honor, would you like to tell us about yourself?
Hello, everybody. I can't see you guys, but you can see me. I'm Honor Williams. I am a graduating senior chemistry major hailing from Atlanta, Georgia.
Thank you. Blessing, would you like to introduce yourself?
Hello, everybody. My name is Blessing Eborka. I am a junior year nursing major from Dallas, Texas, and I have plans to become a nurse practitioner. So thank you.
Tyler.
Hi, my name is Tyler Findley. I'm a freshman biology major hailing from Memphis, Tennessee, and I am interested in general medicine.
Thank you. Hayley.
Hello, everyone. My name is Hayley Brumfield. I am a freshman biology major from Baton Rouge, Louisiana, and I'm interested in becoming a physician with a specialization in gastroenterology.
Thank you. Indya, would you like to introduce yourself?
Good evening. My name is Indya Lusk. I'm a third-year public health major with a concentration in health systems management. I'm from Monroe, Louisiana, and my career interest is healthcare administration and community health education.
Thomas.
Good evening, everybody. My name is Thomas Adams. I am a sophomore public health major from Jackson, Mississippi. I'm looking to become a physical therapist.
Great. And Aaliyah.
Hello, everyone. I'm Aaliyah Gaskins. I'm a freshman nursing major, and I would like to become a nurse practitioner. And I'm also from Alexandria, Virginia.
Great. Well, we're really excited to have you all here. And next, Aaliyah and Thomas are going to give a short presentation about COVID-19 and health disparities, just to kind of get us started.
Okay, once again, hello everyone. Me and Thomas are going to present a presentation on COVID-19 and then the health disparities that are related to it. And then we can proceed to the next slide. So to start off the presentation, I want to talk about what exactly a health disparity is. And that's when there's a higher extent of illness, disability, or mortality among socially disadvantaged groups. And then these are broken down into different factors such as race, ethnicity, gender, education, wealth, sexual orientation, or geography. And then when you dig deeper into these different factors, you can see whereas geography, different areas have different types of access to healthcare facilities, and some people have a longer transportation route to different hospitals and places that provide treatment and testing. I know personally with me, I have multiple hospitals in my area, but I've heard other people talk about how their local hospitals around an hour distance. And that can cause some people to go untreated with serious illnesses. And then when you also talk about the other factors such as wealth, I know a lot of people get insurance through their occupations, and without insurance, getting treated and prescription is very expensive. And some people don't have enough money to go out of pocket on those things, and that causes them not to get the proper treatment or prescriptions that they need.
Hey everyone, next we'll be talking about health disparities and COVID. While COVID-19 has impacted our daily lives and routines, it has further proved the racial and ethnic health disparities which have been prevalent for several decades. According to several studies, it is estimated that African Americans and Latinos in the US are nearly 3 times as likely to contract COVID and have a 4.2 times higher mortality rate than any other race. And this is linked to only health, not any other aspect.
To track back on what Thomas just talked about, where there's a 4.2 times higher rate of mortality among Blacks and Latinos, this graph basically just backs up that statement. So we looked at 5 different cities: Atlanta, Chicago, Cleveland, Detroit, and Los Angeles. And we looked specifically among Blacks, whites, and Latinx. And you see in each city that the Black case fatality is the highest. And this is most likely due to the health disparities. And the next slide, we're going to talk about ways to combat that.
All right, so these are just some examples from the internet that we found, talking about the coronavirus and the minority health disparities. All right, so this slide will be about resolving the racial health disparities that exist. Although COVID-19 has affected us negatively in many aspects, it's brought an opportunity to bring greater awareness to the issues of the racial health disparities and inequities. Some ways to minimize these disparities include improving the communication between healthcare providers and patients, providing all patients access to higher quality care, increasing the racial diversity in all healthcare professions, and addressing the health disparity issues and how to reduce them in professional education.
Thank you so much. Thank you for that presentation. And Dr. Peter Foss, my colleague, helped the students to gather the data for that presentation as well. So now we're going to move into a discussion. And the only thing we didn't discuss is how we'll choose who's going to speak about each question. So if you just want to kind of raise your hand and let me know you want to speak, I can call on each of you. So again, these are all questions that the students came up with as issues that they all wanted to discuss tonight. And the first question is, when and how did you first come to understand the seriousness of the pandemic, and what were your early experiences early on in the pandemic? So I know Honor and then Bailey. Honor, I know you wanted to speak to this. Go ahead.
So hello everyone. Again, my name is Honor Williams. I'm a senior chemistry major here at Dillard. And I wanted to talk personally about a personal experience with COVID. I'm not sure if you guys can see my shirt, but it says that I survived COVID-19. And my mom and I have matching t-shirts, and I didn't want to get that t-shirt made. I really didn't. I hate that we are so far behind as a society, you know. It bothers me. So I wanted to talk and discuss personal experiences, what I went through, suffering from COVID, what some symptoms were going on in my household and things of that nature. So actually, I started with a sore throat. I thought that I slept with the fan too close to myself. I get hot at night, you guys. So I thought I slept with the fan too close, and I woke up and I'm like, Mommy, you know, my throat's hurting. A day went past and we didn't, you know, pay any close attention to it because it was just a regular sore throat. And I thought it was going to go away. I put a throat lozenge in and I kept moving. Next day, throat is still hurting. I'm starting to get a few chills here and there, but that's about it. I'm not feeling any type of sluggish. I'm not feeling like I need to lay down, anything. And then on the third day, that's when I lost my taste and smell. And to this day, I had COVID back in July. It's November 18th. I don't have all of my taste and smell back. And it bothers me. It bothers me that we are so far behind. It bothers me that we have such a poor leader dropping the ball every 3 days. You know, it bothered me the most to know that my mom was at risk, you know, and I couldn't do anything to help her. My grandparents were at risk. You know, my friends were at risk. My dog was at risk because dogs can get it too. Animals can get it. And it's just a really, really, really bad thing. It's a touchy topic. I just feel like we are being a little bit careless when it comes down to thinking about ways to prevent things, thinking about ways to get rid of this. A lot of people say, oh yeah, like let's get prepared for the second wave. We haven't got rid of the first wave. And if any of you guys know anything like I do, yesterday, COVID-19 celebrated a birthday. And as far as I'm concerned, I don't care if it lives to see another.
Thanks, Honor. Bailey, you wanted to speak to that.
Okay, so my story is kind of different, like a different approach than Honors. Once again, my name is Bailey Patterson. So actually, I live in Cleveland, Ohio. Like that's where I reside. And you know, I go to school in New Orleans, Louisiana. So I first realized COVID was serious when I literally had to pack up all of my things within a matter of 3 days to go home. My mom said, I need you on the next flight out to Cleveland. And remind y'all, Cleveland is 14 hours away for a drive, and it's about a 3-hour flight. So I literally had to buy a storage unit to put all my stuff in, individually put all of my storage into the storage unit as well. I don't have a car down here, so I had to go back and forth from the school. I had to find like different resources to get back and forth from the storage unit to the school. And it was just a lot of money that had to go into it as well. So I literally broke down on the phone with my mother crying because I had to go through all of this myself. So it was just a lot. It was very overbearing. So I'm like, dang, this really must be serious in order for me to just pack up everything and just leave immediately. So yes, that's when I realized that it was very serious.
Thanks, Bailey. We appreciate your words, both of you. Do any other students want to comment on when you really came to understand how serious the pandemic was?
I will.
Yeah, go ahead, Tyler.
So when the pandemic first hit, I was in high school. I was a senior, and we were watching the news because I took dual enrollment biology at the time. So we watched it closely in class every few days to see how it was. We didn't even know that it was a thing yet until like February. So once it hit, the initial reaction is, you know, we're going to be on lockdown for a minute. We're just going to have to do what we have to do as a country, and then we'll move back. Life is going to be back to normal. And so then that's when more cases started to surge, and due to improper leadership, our country didn't do what was needed for us to be in a better position than what we are in today. So about April was when I really realized that, you know, we were in a pandemic, and just like the 1920 pandemic, we're going into our second year, well, our first year of the pandemic.
Thanks, Tyler. Hayley, did I see your hand up or no?
Yes.
Oh, okay.
I have pretty much the same type of experience as Tyler and Bailey because I was a senior in high school too, just like Tyler was. And I remember every day since about the beginning of February, we used to track the virus and look at statistics to see what was going on, but we really didn't think much of it because in the US at that time, we weren't really affected by it. So I remember, I want to say the exact date was March 13th. I had gotten checked out of school that day because I had a doctor's appointment. It had nothing to do with the virus, but I remember our school district sent out a message saying that Governor John Bel Edwards was letting us out of school for a whole month. So at that point, I'm like, okay, this has to be serious. Then that month passed and it was like, y'all aren't coming back to school. Y'all probably won't have graduation. Y'all won't have prom. At that point, I think that's when it hit, not just me, but everybody around me, because we realized this is really serious. Like, we really can't live a normal life at this point. We really can't do the things that we had planned and expected to do. And I think the crazy part to not just me, but probably to a lot of people that were affected by the virus is that it happened so fast. It came out of nowhere.
Thanks, Hayley. I think a lot of us share, it's really important for us to hear this perspective, especially of those of you who were in high school last year, to really hear how you felt like you were affected about that. Thank you. Are there any other personal experiences that any of you would like to share, or things that might have happened with any of your family or friends that you didn't get to mention yet? Indya?
So mine kind of speaks to everyone's mental state at the time. So my mom is immune compromised. So when she came to pick me up, we were scared the whole ride home. It's 4 hours from New Orleans to Monroe. So the whole ride home, you know, I had on my mask the whole time. She had on her mask. We were just scared, just trying not to talk about the situation. So before I got back home, she talked to me and said, you know, you're not going to be able to go to your grandmother's house like you usually do because, you know, they're scared. We're all scared for them. So, you know, you're just going to have to try to understand. So when I did get back in town, I spoke to my grandma from the mailbox and she stood on the porch. So that was, you know, that kind of affected me a little bit. As the months went on and I was going to work and my mom was going to work, you know, we agreed to come home, get straight in the tub, put your clothes straight in the washing machine, and we're going to go our separate ways. Because she was having cases at her job, I was having cases at my job. And, you know, everybody was just on edge so much because of so much uncertainty in the media. And, you know, you have, you know, I was working with a lot of different groups of people, and I'm not going to call them by name, but you had the group of people that believed in masks, and then you had the group of people that didn't believe in masks. Mm-hmm. So, you know, just coming to work and having to deal with these different kind of people and, you know, people wanting to argue with you about masks and stuff. I'm like, look, I just thought we all were trying to live. I didn't think it was going to be so politicized. So
that's very powerful, Indya. Thank you. Thank you so much. Any other experiences with family or friends that any of you wanted to talk about that you haven't yet? Bailey?
It's kind of jumping off of what Indya was talking about with her grandmother. So actually, I have a great grandmother. She's 94 years old, and I wasn't able to see her as much over the summer and when I got home just because of COVID and everything. And she was also in and out of the hospital as well because she fell a couple times while she was home. So what we kind of did, my whole family, we were outside of the window because, you know, we weren't able to go into the center or everything. So we made a big sign for her. And it's like, we love you, we miss you, just to show her that, like, we still love her and we still care and we're still there for her, even though we're not able to be physically in there with her. So it was kind of a toll on that we weren't able to just like see her all the time because we know she's older and she can't take as much, you know.
Thank you for that. I think one of the hardest things for a lot of my students and many people I know has been not being able to be amongst, in close contact with our older relatives and friends, so, and loved ones. So thank you for both of you just for speaking to that. So if you haven't spoken about this yet, a lot of you said you wanted to talk about your work and school experiences. So what have your work and school experiences been like during this time? Blessing.
Okay, so as a nursing major, of course, we have to go through clinicals and we go to different hospital sites and such just to get the experience. And so, like they said, it kind of piggybacks on when I realized it was serious. It's like April, and then we get the call that we have to pack up, and then we get the call that, you know, we're not going to complete our clinicals for that semester. And so you're kind of worried, thinking about, wait, am I going to graduate on time? How are we going to make up for this lost time? And so, I mean, luckily, we were able to come back earlier this semester to finish off the springtime. And then that's kind of what we had to do this year. Just, we wanted to make sure we got our clinical hours outside. So like we got them finished quickly, just in case there was another like moment where we would have to leave early again. And so luckily we were able to get that all finished. But yeah, with the clinicals, it's also kind of scary because, you know, you want to finish your hours, but it's like, are we really about to go back to the hospitals? And, you know, it's kind of like we're still students, but this is the job we want to put ourselves into. And so you have to, it was kind of a fear, but I will say that the program, the nursing program, they did a great job because they provided us with a lot of like protective gear. We had masks, we had face masks, even some people were allowed to get the N95 if they were high risk. And so we were well accommodated, and we were even able to get on floors that didn't have any COVID patients. So that even lowered the risk for us a lot more. And so I would say that was my experience as a nursing student. It was just kind of the impact it had on clinicals and stuff.
Absolutely. So Anna, before one moment, I just wanted to say to the audience, our attendees, if you have questions in your mind and you don't want to forget them, feel free to write them in the Q&A or the chat, and we'll get to them at the Q&A period. Anna, go ahead.
So I'm gonna be speaking from a senior's perspective. As many of you know, it's that time for us to start thinking about making a decision on what our next steps are gonna be. And I wanna go to graduate school. I wanna do research. That's where my heart is. Around when COVID hit, it was around like March or April when we had to pack up and abruptly leave. But at that part of the semester, that was when I was starting to get all of my acceptances from research programs to roll in. And last year I had gotten into one of my dream programs at Emory. I had gotten back into the program that many of you know that I did at UNL. And it really threw a wrench in kind of my plans and what I wanted to do or where I saw myself at that time. And all through the summer, you know, I was telling my mom I had a really bad case of imposter syndrome. Like, Mommy, I don't think I'm going to be smart enough when I get, you know, to graduate school. I don't think I'm going to be able to do this thing. I don't think I'm going to have these skills. I don't know how to work this machine. And it was just eating me up inside. So, coming back this semester, it was a little bittersweet because it is my senior year. We have been doing a good job with still trying to get into the labs to get, you know, more hands-on work, but it's definitely been a challenge. It's definitely been a challenge with testing, secondary testing. Some people are taking MCATs, PharmCATs. I'm taking the GRE. I actually took the GRE this morning. So it's just been a lot. And then all of this with us down here in New Orleans with the hurricanes, it's been 20 times as harder. I've had to shift some of my testing dates to back home in Atlanta off of I'm getting in the car on Friday morning and my test is Saturday morning. So it's been a very, very big adjustment. It's been hard. Kudos to everyone. We're all still in it, you know, but it's definitely been hard. It's been adjustment, and all we can do is just take it day by day and continue to pray about it, you know?
Absolutely. Thanks, Hayley. Thanks, Honor. Thank you. Are there any other school or work experiences that any of you would like to talk about before we move on? Yep, go ahead, Hayley.
I'd like to speak from a first year freshman experience, because for us, this is a transition state. So I would say that, not that our experience has been that much different from everyone else, but it's really weird for us because, you know, when you get to college as a freshman, not only is it a learning experience, but but you want to get the college experience because it's your first time, it's your first year. And personally for me, since COVID has affected our first semester of college, we haven't gotten a true college experience. For example, if you want to talk about extracurricular things such as like activities or events to do on and off campus, they don't have that kind of stuff going on as often as they would in a normal setting because of COVID, and it's not safe. And when they do have events, the majority of the time they're virtual. Also, for a person like me, I wanted to start my clinical shadowing and get a head start. I wanted to start my community service hours, but I wanted to be consistent with them and do it within the field that I'm interested in going in. And unfortunately, it's been really difficult to do that because a lot of hospitals, clinics, and care agencies are not allowing people to shadow right now or to do community services just for safety purposes. Also, from an education perspective, online learning is very difficult and people don't realize how difficult it is. I don't think people talk about it as much as they should, but online learning has been a big adjustment for us. Even though it's only been the first semester, and I don't want to let this semester define our entire college experience because that shouldn't happen. But learning online has been a really big adjustment because you have to email professors more than you would in a normal or traditional setting. Classes aren't as long, you don't have as much class time. Tests are online, which means say you take a class like chemistry or a math course, and normally you can answer questions on a test on paper and your professor can say, oh, this is where this person went wrong, let me help you, or let me teach you how to fix this step, versus when you take an assessment online, it's just right or wrong answer. So in general, that's how the experience has been. It's been really different and it's been difficult, but I think we'll be okay.
Thank you, Hayley. I got you, Bailey. Go ahead.
I just kind of wanted to speak off of what Hayley said on the education perspective. So when we went transition to online learning, it was very simple for some professors, but for other professors, not so simple. So Dr. Lisa, I know you did a great job of keeping us on Zoom every Monday, every Wednesday. She did a great job. But on the other hand, there were other professors who used tools that were not as reliable. So like Zoom was a very reliable tool, but like web conferences, sometimes Google Meets, they weren't as, reliable. And teachers would get frustrated, but they didn't know we were getting frustrated as well, because at the end of the day, we still wanted to get a good grade in the class. And even though they weren't as prepared, like nobody was prepared for this. So we all just had to be patient with each other, but it was kind of difficult to do that because at the end of the day, there still has to be a grade on your final transcript. So yeah, that's what I wanted to add.
Yeah, I have to say, as a professor on the other side of the desk, so to speak, I couldn't put it better than Bailey or Hayley just did, honestly. I mean, it's the same exact experience we've had, especially as a professor at a small college like Dillard. The reason we come and work or go to school, I think, at a small college like this is so that we can have such close relationships with each other. And it's very frustrating for everyone. So I think you reflect, and, the learning technology and navigating technology is just as frustrating for professors, like you said, Bailey. So it's, I think this is a universal issue we've been talking about as a society all over the world, but it's really important to hear your perspectives. So the next question is, when we were meeting to discuss this panel, one of you said this sentence, and I want to repeat it and then ask if anybody wants to comment on it. It's a very powerful statement. The student said, the pandemic has put into perspective the reality as pre-health students. The pandemic has put into perspective the reality of the fields we are preparing ourselves for. And I think that's a very powerful statement. And I wanted to see if anybody wanted to comment on what that means to you.
To me,
Tyler and then Indy.
what that means
Tyler, go ahead.
is we have to, seeing how this pandemic is and seeing the frontline workers, it kind of put me in a moment for me to reflect on the path that I'm taking and the risks that come about our job and our duty as healthcare workers. Whether we're a nurse, whether we're a doctor, whether we work in public health, we are the direct contact with any situation like this. So at first I was sort of scared, truly, because looking at how things have been around the country and even in the world in general, healthcare workers are directly on the front lines. You come in contact with that virus likely more than once or twice a day. So at first I was scared, but then I realized the amount of lives that were saved with their work, with their dedication, with their duty. It kind of reminds you of like an army soldier, because we're still gladiators ourselves. We're just health gladiators. We're going to keep you alive. So that's what that comment means to me.
That was beautiful, Tyler. Thank you. Indya and then Hayley. Indya, go ahead.
So before, when I was exploring careers in public health, I was almost positive that I wanted to go and work for the CDC. I feel like that's how I could make the biggest impact. But seeing this and seeing how it affected African-American communities, that kind of drove my passion in the direction towards basically what this whole program is based off of: minority health and health disparities. You know, racial and ethnic health disparities have always been around, but this pandemic kind of exposed it and kind of like put it in everyone's faces, like this is a real issue, not just with this disease, but since this is a novel disease and you can already see the health disparities, that's an issue. But it also gave light to other issues that need to be explored and talked about, like, diabetes and, postpartum depression and things that affect different communities different. So I feel like now moving forward, I want to be in the community, not only as a public health professional, but also as a helping hand in the community, just making everyone aware of these problems and how we can start to eliminate them.
Thanks, Indya. I wish it was a different reason why, but I'm thrilled. I really wish it was a different reason why, but I'm thrilled that you're interested in this field. Thank you. Hayley.
For me, that statement is a reminder that the healthcare field and medicine is a field that is forever changing, which means there's not any consistency, but we're always learning new things. We're always finding new methods to do things. We're always finding out new things about the human body and our organs. We're always finding and trying to discover new medicines. We're trying to find cures for things, etc. So that's what that statement reminds me of. That's why I feel that when we talk about preparing ourselves, we're talking about preparing ourselves to be prepared for anything that comes our way. Because in healthcare, you don't know what can happen. Just like this pandemic showed us, viruses can come out of nowhere. Things can come out of nowhere. Unfortunately, nobody was really prepared, but everyone did their best. And I feel like just what Tyler said, lives were still saved. Yes, over 200,000 people died here in the US, unfortunately, but lives were still saved. And I feel like it's very important. Even if you can save one life, that matters. So that's what the quote means to me. We have to be prepared.
Thank you. Blessing.
Okay, so I think I was the one that made that statement, but I said that because, as I think Tyler said, like, no matter what role you play as a healthcare professional, when COVID hit, you became a frontline worker, you were an essential worker, and you were on the front line of the virus. And especially in the beginning, we had no idea of like any information about it. And so a lot of them sacrificed, their lives. They had to make that decision. How am I gonna fulfill my duties in my career, but also protect my family when I go back home? And so as a student, and I haven't yet reached that mark yet. I had to reflect on myself and what I wanted my purpose to be. Like, do I still want to venture into this knowing the risks? Because we can have a virus, we can have, earthquake, hurricane, zombie apocalypse. You're still you have to, do what you have to do. And it like Indya said, it made me want it more, because seeing how it affects the different communities and just seeing how it was so much misinformation and stuff like that. Like, I want to be a part of that group, and I want to be helping those communities that are affected and just helping dispel any incorrect information and just getting us like back on the right track. And so this time of COVID, that was one effect that it had on me and my career choice. Like, I know that at this point, I really do want to be a nurse, and I do want to finish this career out.
I have to say, I'm so like overwhelmed by how amazing the statements you're all making are, because I don't think everybody in the world would look at this pandemic and say it made me want to be a healthcare worker more. So that's really impressive to all of you. So a couple of you had said that you wanted to discuss being the family of frontline healthcare workers and talk about what that was like for you. So would any of you like to speak to that, Honor?
Yes, I would like to speak. My mom was an essential worker this entire time. She's still on the front lines as we speak. It was hard seeing her come home every day so stressed. And in her department, she was specializing in doing the calculations and getting the information and the raw data with the COVID numbers every time they had a patient walk through their doors. So seeing her stress about that at home, and I was there for summer break, and I'm like, Mom, like, you got homework? And she's like, no, like, this is the COVID stuff. Like, this is what's going on in my hospital. To the extent of her having to like order different things to alter the rooms. Like, it's a certain way that you have to ventilate the COVID rooms at the hospital. So she had to, my mom was like doing it all. And to see her, to witness her doing that, it really just showed me who she was even more. But it showed me that oftentimes in order to see some change, we have to be the change we want to see. And it starts with us. And just because that's her job description and that's what she does every day, she still kind of took it up on herself to be more responsible about it, to still be safe. When she's going to work, she always has on her mask, or when she's talking to other doctors or going on different floors, mask. You have to like foam in and foam out is what they say. So that's just like the foaming stations with hand sanitizer. They have these things called bunny suits. Dress them up. They're hazmat suits, basically. Dress them up, get in them. Like, it's very, very serious. And just being able to witness, it's kind of bittersweet because it's kind of cool, you know? But at the same time, it's like, did we really have to like get here at this point? So that's kind of my gist of seeing essential workers up close.
Thank you, Honor. Thank you so much for that. Anyone else have family who are frontline health workers that you'd like to talk about, Hayley?
Yes, my experience is similar to Honor's because my mom is a healthcare worker as well. And at the time that COVID first arose and really started running rampant around the country, she was working in a Veterans Affairs home. So keep in mind, a veterans home is mostly elderly people. So not only was she on the front lines, but she was working with the hardest hit group. Well, the hardest hit age group, let me rephrase that. So I just remember her coming home every day and it would be like, well, 5 more people died today, or 10 people died today, or they had 30 cases diagnosed today. So I want to say about 35 to 40% of the residents in the home fell ill with COVID and passed away. And that's very unfortunate. But I just remember it being that critical, and it was just crazy. And I also remember her coming home every day, and she didn't come around us at first because she didn't want us to come in contact with the virus in case it was on her clothes or in case she had it. So as soon as she would come home, she would go and get straight in the shower. And then we'd be able to get closer to each other and like have a conversation and stuff. But that went on for about, I want to say that went on for about 2.5 to 3 months. And that's also falling back to the question where we asked, how did COVID affect us, or when did we first see it on the front lines? For me, that was also part of my experience, because I realized how serious it was seeing my mom affected by it firsthand.
Thanks, Hayley. Sounds like you're really inspired by your mom. That's really wonderful to hear. So we have one more question before we go into Q&A. So again, if any of the attendees here in the audience have anything they'd like to ask the students, or even comments, you can go ahead and start typing them into the chat or the Q&A. So the last question is related to an earlier one, but is there anything else that any of you would like to say about how this experience in the pandemic so far has affected the way you will work in the future as healthcare professionals? Tyler, looks like you wanted to say something, but you're muted. Yeah.
So this has kind of showed me that we always have to be prepared. And this pandemic was something that showed us how vulnerable we are, not only as a country, but just us as a field in general, that we never know what may arise when you're working in healthcare. So it reminds me to be cognitive of everything that I do and the steps that I take just as a pre-health student, to make sure that I grasp these concepts, because one day it's going to be needed, whether I decide to work in research or work in public health or even work in a hospital.
Thanks, Tyler. Anyone else want to talk about the effect this has had on your future thoughts? And Thomas and Aaliyah, I know we heard from you earlier, but feel free to raise your hands and talk if you'd like to. Any other comments about how this has changed your perspective on what you'd like to do in the future, or how it will? Blessing.
Well, I just wanted to say something that I noticed during especially the beginning of the pandemic, is how, I don't know if it's underfunded or just the lack of supplies that a lot of the healthcare workers had when they were hit with COVID. You know, I saw a lot of nurses saying how they had to reuse PPE and reuse the N95s, and they just were talking about a lack of resources. And so I hope that one of the effects of this pandemic is that, like, we can figure out a way to provide the necessary resources and finances so that our frontline workers don't have to, like, ration out the things that are needed to protect them as they're trying to help, you know, our loved ones and other people. So that's one thing that I noticed, and I hope that we can eventually help out.
Great, thank you. Honor. Mm-hmm.
One takeaway that I had from this experience, and it's probably different than you guys', was to not listen to everything that I heard that the media put out. And that's something that's very important, being a professional in the healthcare field as well. You have to depict between what's true and what's not. You have to also do your research. So if it's something that you're uncertain about, go do it yourself. One thing that people talk about with COVID is a fever and the temperature that people might have when suffering from COVID. I think that every time someone puts the little temperature gun thing to my head, that is stupid, because when I had COVID, I never got the fever, which means that's not a true measurement of someone having COVID, because the symptoms are not the same in all patients. So that's my takeaway moving forward, knowing to dot all of my I's and cross my T's when moving forward, especially when spreading information.
Before we open it up to the audience for any questions or comments they might have, any last things that any of you haven't said that you'd like to make sure the folks hear? Yeah, Hayley.
This will be brief. I just want to piggyback off what Honor said. I totally agree with it, because I'm the type of person that when I get sick or when I catch something, I normally get the secondhand symptoms of that illness, which means at first, if you tested me or if you were trying to figure out a diagnosis, you wouldn't think I have that. But if you, like, for example, I had mononucleosis about 1.5 years ago. but I didn't have the general baseline symptoms like the swollen lymph nodes. All I had was, I had nausea and I didn't feel good. I couldn't really eat. I lost my appetite and I was fatigued and I had a headache all the time. So it just hits home for me when talking about paying attention to symptoms and realizing that just because a patient doesn't have the general or normal symptoms, that doesn't mean they don't have the virus or the illness that you may think they have. Because for me, it took them 3.5 weeks to find out I had mono. And by then I felt horrible. So as going forward into the healthcare field, I will make sure that I test my patients for everything and that I examine every symptom, and I won't count out any illness that could be possible, because I feel like that's really important.
Thank you. So we actually have a couple of questions and comments. Dr. Stephen Farrow, who was here last night, thanks for returning, has a couple of questions. So the first is, and maybe we could just see a show of hands, how many of you are first or second generation university healthcare students? So pretty much everybody. So we have a lot of legacy students here, but also first generation students. So that's very powerful as well. And we're very proud of that at Dillard. And then Dr. Farrow also asks, you all have discussed your interactions with your immediate families. Have any of you been asked by your extended families, so like family reunion groups, or have any of you endeavored to interpret the COVID pandemic for your extended families or advise them on health strategies? Which is a great question. And he wanted to start with you, Honor, because of some of your comments earlier, but we'd like to hear from everyone. Do you have
Yes, I have taken it upon myself to be that one in the family, the police officer, mask, hand sanitizer, social distance, backup. But outside of all of the jokes, I've definitely been one of the ones in the family to explain really how all of this works. Like I said, I'm a chemistry major. So last year, just last semester, I was in biochemistry and I understood and learned how all of this virus stuff works. So all break, I was spending my time explaining exactly what was happening to my family, down to like the transcription, like literally. So I've definitely taken it upon myself to make others aware and just bring awareness to my surrounding communities as well.
Great. So any of the other of you have any comments about feeling like you've sort of interpreted or educated people in your family or in your circles around this? Anyone?
I was just gonna say, when my mom was at work, a lot of times she would call me on her break and, Indya, tell my coworkers that it's not true that you can get the coronavirus from this. Tell my I told them you was in college. And my uncle, I have a very elderly uncle that lives in New Orleans, and he would call it, hey, yeah, you in medical school, right? I was like, no, sir, I'm not. But you know about that COVID, right? You could tell us about that COVID, right? Okay, yes. Just stay in the house, just wear your mask. I don't know. So that's just but I feel like it was kind of comforting for my family members to know that they did have someone that was actively staying at the forefront of public health and trying to learn as much as I could for their sake and mine.
Great. Anyone else have anything to say about being an educator? Bailey, was that you? Okay.
So actually I was kind of the beginning educator for everybody. During spring semester, I actually took an introduction to population health class. So that COVID was actually the first thing we talked about in class in like January. So I would tell my mother like over the phone, like, it's a virus that's going around in, what was it, China? It was China and everything. And she was like, okay. Like she wasn't taking it serious at all, but it started coming to light and she will always come back to me for more information. I'm like, now you're starting to believe me? Now that is actually like coming towards us now. I'm like, I've been trying to tell you this for 2 months. So yeah, I was like the initial like motor of the virus to let everybody in the family know.
Wow. That's not even something I've thought so much about. So that was a great question and really great answers. We have a comment from someone who I think has been here, if not every night, at least the past 2 nights. Mr. David Allen said, thank you for a great presentation, all caps, and it was very refreshing to hear the viewpoints of students. So we have some appreciative audience members. Are there any other questions from the audience that anybody wants to type in before we close? It doesn't look like it. All right. Well, I just wanted to say thank you, all of you students, for really putting together a really great panel. And it's been, I've learned a lot, honestly, from hearing you. It's just been a wonderful evening, and I'm really glad that we did this tonight with you all. And I think we should do it again on some other topics. And thank you so much to the provost and to Dr. Foss for helping our students and for meeting with our students and discussing this, and Tracy for your unflagging work and loyal work with the students, and to Tiffany for all your work as well. So this has been a great evening. Thank you so much. And for everybody who's here, tomorrow is our last night, and we're going to be with, we're going to be getting a clinical perspective. So we're really going to hear the perspective of people who either work in medical schools and with medical students and doctors, or from physicians themselves. We're going to hear from Dr. Christy Anderson, who's a social scientist, who's the director of graduate medical education at LSU School of Medicine in Lafayette, Dr. Marilyn Marshall, who's the program director for the LSU Family Medicine Residency Program at that medical school in Lafayette, and Dr. Nicholas Sells, who is an infectious disease specialist, and also the section chief of internal medicine at the University Hospital there. So please join us for our last evening tomorrow, same place, same time. And we appreciate everybody being here. Thank you so much.